25-year-old Huda Dawood is 9 months pregnant. She fled Sinja in central Sudan to Port Sudan 2 months ago to get medical care and ensure the safe delivery of her child.
As a pregnant woman, safety and health care is a priority. Pregnant women need good nutrition for herself and her baby as well. This is why I left when RSF took over Sinjar and crossed all of this distance to Port Sudan. The situation isn't ideal here, but better than conflict zones where we don't have any operating hospitals.
Dawood is among hundreds of thousands of Sudanese women who are experiencing one of the ugliest sides of the war.
According to the United Nations, there is over 1.2 million pregnant and breastfeeding women are facing a lack of health care alongside poor living conditions and malnutrition, putting their lives and the lives of their children at a grave risk.
The unsafe roads have complicated access to healthcare facilities, leading to numerous problems and increased deaths. And that's made many Sudanese women prefer to rely on home birth and traditional midwives.
The number of women who come to us is higher than before. They can't afford the high costs of hospitals and also come from regions far away in very vulnerable situations. Most of the pregnant women I see are displaced and malnourished. They need more care and attention as well as the newborns.
Experts estimate a 15% increase in the maternal mortality rate during birth in the wake of the civil war, a direct consequence of 80% of the country's hospitals and health centers being non-operational.
The extension of the conflict to wider regions has not only contributed to the destruction of health system, it has also contributed to the loss of crucial data regarding women. There is lack of sexual health, maternity care, and the medical care for the chronic diseases women are suffering. Those issues need different interventions and operations that are overwhelming the fragile health system.
Alongside unprecedented mortality rates, there is over 500,000 missing women whose whereabouts remain unknown due to a lack of official records and the reluctance of families to report cases. It's a concerning situation for women in Sudan that could well worsen further if the conflict doesn't end soon. Naba Mohiedeen, CGTN, Port Sudan.